The Shipley and McAfee Fluency Rating Scales. The Shipley and McAfee Fluency Assessment evaluates stuttering through the use of speech samples from the client. The speech samples are then assessed using the following forms.
Kelly is 10 years old and has recently entered 4th grade. Her parents are becoming increasingly concerned with her behavior and her self-esteem. Kelly comes home on a daily basis crying that other children mock her or exclude her from activities because she talks funny. She is now starting to throw tantrums, refusing to attend school at all. Kelly developed her stutter when she was 3, and her parents always believed she would outgrow it, like the other children do. But now that she is 10, it is affecting Kelly not just at home, but in school and amongst her peers. They believe it is time for treatment. Kelly's stuttering can be characterized by repetitive body movements while speaking, which helps her get her words out, speaking around words instead of saying them, and often exploding words in loud bursts. Words containing the phoneme B are often troublesome. Kelly's parents now accept the fact that her stutter requires remediation. They are pained seeing their daughter withdraw from others and have decided to seek out the opinion of a speech pathologist. They are hoping that with treatment, her stutter can be improved upon as well as communication skills.
Clinician-parent interview.
Hi, I'm Leah. I'm the speech-language pathologist
I'm
here.
Samantha. I'm Kelly's mother.
So I heard you came in today because you have some current concerns about your daughter?
Yes, I do. She stutters, and she always has, but more recently she came home from school crying and saying that she was made fun of. So I always thought that it was going to go away on its own, but now I feel that it needs some intervention because it won't go away on its own.
Okay, I'm going to have you go home, and whenever Kelly has a stutter or you notice it, just fill this chart out, and then we're going to run some tests when you come back, and we'll see exactly where her problem areas are.
Oh, okay. Thank you.
It is a chart used for parents to record their own observations of their child stuttering in the home. Sampling the parents' attitudes is part of the evaluation process because they live with their child. They may have feelings of fear, anxiety, and concern for their child surrounding their stuttering problem. Parental speech chart.
Hello again.
Hi.
So I see you brought back the chart?
Yes, I filled it out. These are just some examples. I couldn't get every single one that she did over the past week, but these are just a few.
Okay, so it's happening very frequently.
Yeah.
Okay, I'm going to run 2 tests with your daughter, run some speech samples, and see exactly where the problem's happening, and then we'll figure out what to do next.
Okay, thank you.
You're welcome.
Speech samples should be determined in several different environments, including the therapy room, outside, and at home. Different modes of speech should be considered as well, like reading and spontaneous speech.
Hi, Kelly. I'm just going to have you read a story, and I'm going to record it and listen to it later, okay?
Okay.
A spider is an amazing animal. It can build its own home, and it doesn't even have to chop wood or buy a saw. Before the spider begins to build, it looks for the perfect spot. A spider usually likes to live in a grassy area where lots of insects can get caught in its web. Then the spider eats the insects for dinner. The spider also has to figure out which way the wind is blowing. The wind has to be on the spider's back before it is able to make its house. After it finds a good place to live, it is ready to spin its webs. The spider has glands in its stomach that produce a silky liquid. It jumps from one side of the house and is carried by a rush of wind to the other side. As it travels through the air, the liquid comes out. As soon as the liquid hits the air, it becomes solid, making a fine, rough, tough thread. The spider uses the first thread as a bridge to travel from one side to the other. Then it continues to build its web strand by strand until its home is complete.
Nice job, Kelly.
Thanks.
I'm going to show you some pictures and I'm going to tell you a story about each of them. After I'm done telling a story about the first one, I just want you to try to retell me what I told you, okay?
Okay.
So first, look at this picture. One day, when Lydia was watching television, an amazing thing happened. The animals on the screen came to life in her living room. A bear, a monkey, and a lion were looking right at her. Lydia was very scared. She tried to tell her mom, but nothing came out of her mouth. What do you remember about that story?
When Lydia was watching TV, the animals came out of the TV, and there was a monkey and a lion and a bear, and she got scared and she got her mom.
Nice job. Okay, we're going to do this picture now. Are you ready?
Yeah.
Then the animals started talking to each other in a funny animal language, and Lydia did not understand. Finally, in a quiet voice, she said, "Where did you come from?" What do you remember about this picture?
The girl Lydia, she saw then that the animals started talking in like a weird way, and she didn't know what they were saying, and that's it.
Nice job.
The S scale helps clinicians to gather information and understand a client's feelings and attitudes about his or her stuttering behavior in various speaking situations. This information is helpful for making decisions about the client's care. This 24-item form can be re-administered over time to assess progress.
Kelly, now I'm going to have you fill out this survey.
Okay.
It lets me see how you feel about your speech production. Circle T if the statement is true for you, and F if the statement is false. If the situation is unfamiliar or rare, judge it on an if it was familiar basis. Okay?
Okay.
The modified S scale form.
After the speech samples are completed, the clinician fills out the form.
A spider is an amazing animal. It can build its own home, and it doesn't even have to chop.
The clinician refers back to the tape recorder to identify and record specific disfluencies.
Spider begins to.
We use the fluency charting grid and the frequency count for disfluencies form to identify and quantify disfluencies. The fluency charting grid is used to count the total number of fluent and disfluent productions and their type. The frequency count for disfluencies form is used to tally the occurrences of each type of disfluency.
The frequency count for disfluencies form. Disfluency indexes refer to the percentages of disfluent speech present in the speech sample. To calculate the total disfluent index, follow the directions below.
Separate indexes can be determined for each individual disfluency type, for example, a total repetitions index.
Calculating the disfluency index form.
Many stutterers exhibit extraneous body movements along with their disfluencies. These secondary behaviors present only during disfluent speech. Not all stutterers have these secondary behaviors. These behaviors usually involve parts of the face including eye blinking, wrinkling the forehead, strong exhaling, frowning, or distorting the mouth. Sometimes these behaviors can include other parts of the body like arms, hands, legs, or feet. Assessment of associated motor behaviors form. This form helps clinicians identify the respiratory, phonatory, articulatory, and prosodic aspects of speech production associated with stuttering to help determine whether these factors are present during fluent and disfluent speech or only during disfluencies. Assessment of physiological factors associated with stuttering form. The rate of speech can directly affect a person's articulation, intelligibility, voice production, and fluency. The importance in measuring someone's speech rate is to see if the speech rate is normal, faster than normal, or slower than normal. The standard words per minute index is hard to produce due to normal speakers having varying speech rates.
To determine speech rate, use a tape-recorded sample of connected speech that does not include a lot of pausing in oral reading, conversational speech, or both. Use a 60-second interval, count the number of words produced, and that would be the words per minute. A stopwatch can be used to keep time. The average words per minute for adults and children.